Hi, my name's Cynthia Payne.
I'm here to tell you about a drug that's sweeping Woodstock, Ontario.
It's heparin. Let's get started.
Heparin's action prevents conversion of fibrinogen to fibrin and prothrombin to thrombin by enhancing inhibitory effects of antithrombin 3.
Therefore, heparin functions to prolong coagulation time, thereby preventing excess clotting in the blood vessels.
Heparin is a natural substance found in the liver and the lining of the blood vessels. Heparin will not dissolve clots that have already been formed,
but it may prevent the clots from becoming larger and causing more serious problems.
and help prevent the formation of new clots. Yay!
Heparin must be given by subcutaneous or IV bolus injection or continuous infusion as it is poorly absorbed by the GI mucosa.
IM injection is contradicted due to bleeding risk.
The dosages for DVT and PE for adults are IV bolus of 80 international units per kilogram, maintenance IV infusion with 18 international units per kilogram per hour, and for a child, it is IV loading dose 75 international units per kilogram, and a child under 1 year is maintenance dose of IV 20 international units per kilogram per hour.
Prophylaxis for DVT and PE dosage adult is subcutaneous 5,000 units every 8 to 12 hours.
Dosages for IV catheter occlusion prophylaxis, adult/children IV 10 to 100 units per mil, and an infant under 10 kilograms is IV 10 units per mil. Heparin antidote, protamine 1 milligram per 100 units of heparin.
When administered by intravenous, the onset for action is immediate. Subcutaneous may take up to 1 hour for maximum therapeutic effect.
The half-life is 1 to 2 hours depending on the dose, and it is excreted in the urine. Let's see if heparin is right for you. Have you or someone you love been diagnosed with
Deep vein thrombosis,
pulmonary embolus,
disseminated intravascular coagulation,
unstable angina,
AFib with embolization,
experienced a heart attack?
require dialysis or transfusion procedures?
Then contact your doctor.
heparin might be right for you.
Wait! First, ensure you or your loved one does not have diabetes,
Alcoholism,
Are pregnant or thinking of becoming pregnant, as it is pregnancy risk category C, although will not transfer into breast milk.
have renal disease, leukemia,
peptic ulcer disease,
if you have a hypersensitivity to corn or porcine protein,
Hypertension,
subacute bacterial endocarditis,
if you or your loved one are taking salicylates,
anticoagulants,
dextran, NSAIDs,
platelet inhibitors,
penicillins,
SSRIs,
or anti-neoplastics.
heparin may not be right for you.
Common side effects include fever,
Headache,
chills,
Hematuria,
hemorrhage, rash,
dermatitis,
anemia,
injection site reactions, hyperkalemia,
hyperlipidemia,
anaphylaxis,
alopecia, hematoma,
urticaria.
cutaneous necrosis.
If you experience any of these side effects, notify your physician.
Avoid taking any herbal supplements while on heparin.
Use a soft bristle toothbrush to avoid gum bleeding.
And use an electric razor instead of a disposable.
Avoid contact sports.
Avoid over-the-counter medications unless directed by your prescriber.
Ask your physician about heparin today.